and I apologize if this created any inconvenience, but since it is archived on our websites, you can watch it anytime you want, 1 o'clock in the morning, 5 o'clock in the morning, whatever works best for you. So just some updates today and some things that I've found interesting and thought I would share. First, how are cases and case counts going in the country? Overall, a lot of states have stabilized that were having problems in the midsummer, and the New England and upper mid-Atlantic states that got hit so hard last spring are still continuing to do well, actually. And they're still slowly, quote, opening their economy with restaurants and such coming up now in some of the states. But their case counts have been pretty low. The ones that still are, the states that are still continuing to climb are, for the most part, in the Midwest, Missouri, North Dakota, South Dakota, and sort of that swath, up and along just the other side of the Mississippi River and up. So what's making the difference between the states that are doing better and the states that are doing worse with time largely is which states are more encompassing and using masks with their populations. So for the more mask use and the more personal distancing that people adhere to, the better off the case counts are. And when we look here in North Carolina, while we're still slowly but surely decreasing our daily case counts, there are some areas in the state that are a little bit stuck. One of these in our area here in the Triad is Randolph and Guilford County and Rockingham County. And I'm getting to be a little bit concerned about those areas because while there are a lot of counties where we're still slowly declining, including here in Forsyth County, Guilford, Rockingham, Randolph, and some others just aren't. And as we get into the colder months, the higher your baseline rate is, the harder you're going to get hit in the wintertime. Is this because there are some counties that are embracing more mask use and distancing than other counties? I don't know. We haven't studied that. But that would be one hypothesis that I would want to test because I would assume that might be the case. How are we doing with our schools in the area? Universities, the ones that have gone in person here in the Triad area, Wake Forest, Elon, a hybrid model at Winston-Salem State. So far, so good. Well, if you look at Wake Forest's dashboard, which is on the website, you'll see it's just a little bit over 70 cases now in the last 14 days, which if you parse it out for the size of the population and activities, that's about what we would expect. And 90% of those cases at Wake Forest have actually been amongst students who reside or live off campus. And you've heard about all of the parties and the big events at other schools that have created problems. At Wake Forest, it seems to be more small, more personal gatherings, people getting together for lunch, for breakfast, a few people over to the house to socialize, and those are the areas. So even though the numbers are smaller and it doesn't seem like it would be quite as dangerous because it's not a big party, even the smaller gatherings or when you're getting together with friends for a small event or just a chat, you got to make sure you stay distant, use your masks, and it'll be a lot safer. How are the private schools doing in the area? So while the public schools here in Forsyth County haven't opened yet, and they're all virtual, a lot of our private schools in the county have. And so far, so good, actually, within these schools. So for the most part, the schools are going kind of with the quote Plan B model that was rolled out for the state. but most places have chosen to put it off a while. And so they're using masks in their schoolrooms. They've got the desks spaced out. They've decreased the sizes of their classes. They're cohorting their classes, which means that they're keeping together people rather than having them scatter about through the day and move around, and eating lunch in the classroom, and basically following good safety measures for COVID. And the number of cases have been very small, and the ones that have happened actually have been transmissions that have occurred in households or outside of the school itself. So I think that gives a little bit of encouragement for what public schools, if they decide to bring their students back for in-person learning here in the near future, with some of these measures that we've learned and seen in our private schools that seem to be working, that it can keep our students and our teachers and our staff safe in the schoolroom environment. And that the main areas to keep an eye on would be on those activities that families are doing outside of the school, actually. So yeah, I'm encouraged by that. Would I just open schools with no masking, no distancing, and no special measures? No, I would not do that. If you're going to open a school or a school district, one needs to pay attention to the details that will help keep our students, teachers, and staff safe. So that's a little bit about that. So what else is going on out in the country? I found some stuff that actually didn't make the media, but I thought I'd bring it out because it's kind of some important information. We've always been a little bit interested in household transmissions of COVID, because I've been saying all along that COVID transmission, the highest risk for COVID transmission is in a household itself, much more so than a workplace, much more so than casual contact on the outside. And we have some information now from across the world on what that risk of household transmission is, and it's called the secondary attack rate, which defines if you have a case in a household, what is the percentage of people in that household who will get it from that person. So a study done in Denmark showed the secondary attack rate to be 17%. Denmark has smaller families. The households are usually not as crowded, even though the houses are smaller, but the family size is smaller, and they tend to do a bit of a better job of distancing even within the home and keeping people separate and apart and using masks. So 17%, which is on the low side. Now if you go to Lima, Peru, where the households tend to be larger with more people in the household, I think the average was almost 5 people per household, and the buildings were a bit small, the secondary attack rate's 53%, which means if you have one case in the household, about 53% of the other people in the household will get it. And then in the UK, in England, it's kind of in the middle. It's about 37%. So what do we learn from that? Well, the more people you have in a household, the more crowded the household, if you get a case in it, the higher your secondary attack rate, the more likely the other people in the household will get it. And so if you have become or know of a positive now, and it's in your household, then you should be thinking about how you can keep other people in the household from getting it. And basically that means that the person who's infected should be wearing a mask at all times, avoiding common areas if possible, taking their meals when the mask comes down in a private area outside of their own area. And then we can decrease that secondary attack rate in our households. The other study that came out is a little bit sobering, I think, because we've always been saying, you know, that younger people between the ages of 20 and 35 are less likely to get infected, or not infected, but less likely to get hospitalized with COVID. And that is true. They are less likely to be hospitalized compared with older people, particularly people over the age of 65 or people with comorbidities. But they do get hospitalized. And it doesn't mean they're protected or have a magic, shield around them. And when they do get hospitalized, 21% of them will end up in an ICU. About 2 to 3% of them will die. 10% on ventilators. So even though you may be younger and between the age of 20 and 35 and you think yourself immortal, which most 20 to 35-year-olds kind of do, if you do get hospitalized with COVID, it's serious, very serious business. If you have a comorbidity and you're in that age group, such as diabetes, obesity or increased weight, or high blood pressure or heart disease, your risk of dying from COVID is actually the same as a 65-year-old, even though you're in the 20 to 30-year-old group. So even if you're young, you should still be careful and take COVID seriously and take precautions. A few other things in the news. Vaccine trials. We talked last week about how AstraZeneca's trial of their vaccine was halted because of a single adverse event that they wanted to take some time and look at. That trial is now back open, at least in the UK, and I think it will be here in the United States pretty soon. The event was putatively an inflammation in the spinal cord, which is a rare happening. There weren't any other people with that in that trial. Whenever you have a very rare event, when you have a very large trial of people, sometimes it's a little hard to sort out whether that's actually related to the vaccine or not. In this case, it was deemed that it was unlikely enough that the trial could go forward. Here in the United States, I think earlier this week, Monday or Tuesday, it hadn't yet reopened yet, but I think that trial will reopen in the U.S. soon if it hasn't already in the last day or so. Moderna's vaccine trial, the one that we're doing here at Wake Forest Baptist Health, which is a messenger RNA vaccine, a two-shot series. We need more minorities in that study, or disadvantaged people, ethnic and racial minorities, because we want to make sure the vaccine is safe for everyone, not just a single subgroup. So if you have interests in that, you can contact us at Wake Forest Baptist Health. And the trials, you can find out more information about it on our website. Other things in the news lately, Big Ten football. Big Ten decided to come back with football. We had our first football game here in Winston-Salem with Wake Forest playing Clemson. The outcome was as you would expect, but hey, Wake Forest did okay. I mean, given their opponent. It was done without fans, which will be the way it will be here in North Carolina for a while. So ACC's up and going. And so the Big Ten, I think, decided to relook at their whether or not to start. I was asked yesterday in an interview whether I thought it was a good idea. And I said, well, we'll have to see, even though like I said, cases are unusual in younger people. Occasionally there can be severe cases. So every school, every parent, every team is going to have to look at how they're okay with the risks themselves, and as a society at large, and we'll see how things going. I still predict that college football is going to run into issues with logistics as more people get infected. In the college teams as more competitive play happens. Interestingly enough, there are some schools that so many people in their football team have already gotten COVID during the late summertime, during their training period and their summer camps, that the team might be reasonably immune. So we'll have to see how that plays out for them as time goes on. So maybe for some of those teams, getting everyone infected early was better. I don't know. I personally would rather not have COVID, but we'll see how it goes for him. And a few things about influenza. So flu vaccines are out there now. Let's get our flu shots. We don't want two viruses circulating at the same time, a flu and a COVID virus. One of them you can reasonably well prevent with a shot that's safe and effective, and that's the flu shot. So let's go get it. Time to do it now, and let's not put it off. I guess there's a little bit of a myth going on out there that a flu shot can give you a false positive test for COVID. That's actually not true. It doesn't. And so you don't have to worry about that. We try not to give vaccines when people are actually in the throes of being ill, and that would include flu vaccine and the COVID vaccine when it comes down the pike. But we are going to be giving and offering flu vaccine to everyone discharged from the hospital, including those people who've had COVID and have been hospitalized for it. So it's important to get yourself protected from the flu. And the proverbial myth that comes up every year that every year I get the flu shot and it gives me flu, that's just not true. Flu vaccine's deader than a doornail, and you can't get flu from the flu vaccine. So let's go get our flu shots. And a little bit about when we might be able to get a COVID vaccine. Despite all the disparate information that you might be seeing from the media, from different people in our government, the flu vaccine really is not going to be up and available till probably around the midwinter, in and around Christmas time or just after. We will be immunizing, I think, healthcare workers first, people who are at higher risk of having complications of COVID, and that includes people over the age 65. And then as we get more and more people immunized in those groups, then it'll be being opened up for more of the population at large. So some people say that may not be until the summertime. Well, it could be for some groups. If you're a very low risk group, you'll probably be vaccinated further down the road than people who are at higher risks or at higher risk of exposure, which I think will be more in early spring time frame, personally. So will a vaccine be safe and effective? Effective, we won't know until the trials are done. So far, so good on the safety end of things. And I really feel quite strongly and passionately that unless a vaccine is shown to be safe and effective, it shouldn't be rolled out until it is. I'll be here to let you know my thoughts about the different vaccines as they come out down the pike. So with that, are there any other questions?
Excuse me. I have one more question about schools. With cold and flu season approaching at the same time as a lot of these schools are opening, does that add any kind of like extra danger, or are the precautions they're taking for COVID already dealing with that?
So the question is, the cold and flu seasons comes up at the same time that COVID is around for schools. Does that add any extra danger? Danger, not so much. Complexity, yes, because it means that kids who get sick need to have it sorted out, whether they have COVID or whether they have flu or whether they have a cold. And so it'll be important for kids to get tested and evaluated if they have a flu-like illness, which is fever, cough, sore throat together. And because the time you have to stay in isolation is different for all of them. So COVID, it's 10 days, right, from the onset of symptoms. Flu is for 24 hours without a fever. And then cold, if you wear your mask, it's probably go back as soon as you start to feel better. So, yeah, it'll be important. It does add a layer of complexity, though. And right now, I don't know how, if there's enough tests out there in our primary care practices yet. Hopefully, as we get further and further down into the fall, there'll be more. Because the antigen tests are being rolled out now, And just this week, Roche's Lariat Test, which is a PCR test that tests for COVID, flu A, and flu B, all at the same time. So one swab and you can get it all done. So that just got FDA approved this week, and so you'll be seeing that rolling out too. I know several practices, including our own here, that'll be getting these. So, good question. Yeah.
That kind of answered my question is, with all this coming at one time, how people want to handle it. Like they come in with symptoms that are very similar.
Yeah.
and with that one thing, there'll be I was going to say, what's going to happen? Are they going to, when you come in, is the doctor going to test you for the regular flu first, then do the COVID test? But with this new one, you can do it all at once.
Right. Yeah. So how are people going to handle it when COVID and flu are circulating at the same time? As well, there'll be if you can get tested, you'll probably should get tested for both. And which one would a doctor do first, flu versus COVID? Probably doesn't matter much, but it'll be in the same sitting, I think. And most of the flu tests can be done, right in the office right now. And as time goes on, more and more of the COVID tests will be able to be done right in the office. And so that, I think that's how we're going to have to sort those out. But it's interesting because those things that we do to prevent COVID, distancing, avoiding large groups of people, staying home when you're sick, and wearing your mask, which is really important, will also prevent flu. So, maybe it'll be a good way to get through the whole season without getting anything if you're careful. All right, so if you're getting ready to tune in for 10:30, we blindsided you. It's at 10 now. And so starting this today and going on through next week, but it is archived, so pass the words to your friends that if you want to tune in, you can get it off the website. So with that, we'll see you next week, and I think next week we'll talk how do you tell the difference between flu and COVID, and how might this affect your family. So we're kind of devoted to a cold and flu episode for next week. Thanks much.